Okay, my patient is a 75-year-old woman named Patricia Young. She presented to the ER at 4 p.m. for some generalized abdominal pain, back pain, and burning while urination. She came to the floor at about 6 p.m. Her daughter's at bedside. The daughter just reports an increase of confusion, lack of appetite, and lack of intake of fluids. She does have a new onset of incontinence, has no known drug allergies, is a full code. She does have some labs pending, like a CBC, CMP, and a lipid panel, and has been diagnosed with a UTI and new onset of confusion. I did straight catheter to obtain her UA, which was positive for nitrates, leukocytes, and white blood cells, and we did complete a CT of the head this afternoon. So family history, she herself has a history of high cholesterol and is on Lipitor. For that, she was diagnosed with this in her late 50s. She does have history of UTIs and reports getting them like once or twice a year with typical treatment plan of antibiotics. She does report missing doses just because she forgets to take them. She doesn't use a pill box or anything to organize her medications. And she does not know if she has taken her medications today, but knows she took it yesterday. Her family history, she has a history of high cholesterol, heart disease, heart attack, and her mother passed away from a stroke. She lives with her daughter, and because her husband has been gone for 11 years. So upon assessment, she reports feeling feverish, confused, and more fatigued than normal. She denies having any abnormal discharge, cough, chest pain, and shortness of breath. She does report having some more difficulty walking and is more unsteady on her feet than normal. She is still able to bathe, toilet, and feed herself independently. The patient's vitals are stable. She remains hypertensive with her blood pressures running from 140s over 90s. It has a temperature of 100.4. She does have D5, 0.45% NS running at the ordered rate of 83 mils per hour for 2 liters. She's alert and orientated to a person, place, and situation. She reports this pain feeling like a deep ache in the back and stomach and burns while she urinates. She did not rate it on a scale. She doesn't comprehend what the scale is, so we'll have to get a face chart in there for her. Her urine is cloudy, reddish orange, and has a foul odor. Her perineum area is red but free of sores and bleeding. She has no wounds or sores on her body. Heart sounds are good, regular rate and rhythm, no extra sounds. Lung sounds are clear. Slight tenderness upon palpation in the suprapubic region. No bladder distension though, so that's good. CVA tenderness noted. She does have some tenting going on, dehydrated. Her gait is kind of hesitant. Definitely use a gait belt. She has some deviation of her pathway, so she is quite a fall risk. Her cognition test resulted in patient drawing the correct clock, but could only recall 2 out of the 3 words. Since she's been up here, she had an incontinent void, and she voided 80 milliliters in the hat, but has not stooled since admission. She's drank 120 mils and 83 mils through her IV. She hasn't eaten for me yet, and she can't remember when she did last, so we should probably talk about that. So I just recommend that we need to get her acute pain under control. I tried to talk to her just to determine a comfort function goal and exhibit the understanding on how to notify a healthcare member if she experiences pain greater than her comfort level. Some interventions can help with this is just to remind her where her call light is, review her medication list to determine potential interactions, and use an appropriate pain assessment tool like that FACE tool that I mentioned. We are encouraging her to push lots of fluids, and we will start her antibiotic here at 7 p.m. So she has been using a heating pad for pain, and that has been working for her, so we should continue to do that. We also have standing orders of vital signs every 4 hours with a temperature, eyes and nose, prevention of falls, toileting every 2 hours, and neuro checks every 2. We are starting her on Bactrim, 1 tablet every 12 hours, and has ibuprofen available for pain. Otherwise, she's very pleasant and sweet, and she shouldn't be too big of a trouble for you. So, do you have any questions? Okay, you should have a good night.